Hello there. Thanks for tuning in to the Highmark Health Options Health Awareness Series. We're glad you're here. Today we are going to talk about communicating with your doctor, why it's important to talk with your doctor, how to get help in your language, and how to actually talk with your doctor. This is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your doctor or other qualified health provider with any questions or concerns about your health. Here are the topics we will cover. Why is it important to talk with your doctor? How to get help in your language? How to talk with your doctor? Let's go ahead and get started. So why is it important to talk with your doctor? Your relationship with your doctor is a key to improving your health, so having honest, open communication is essential. Why is it essential? Because you want to live as long and as healthy a life as you possibly can. It's important how you talk with your doctor and how they understand you. And it's important how your doctor talks to you and how you understand them. When you understand your doctor and they understand you, you're better able to make informed choices when it comes to your health. When you talk with your doctor, there are lots of things you might want more information about. This includes medicines, appointments, understanding what your doctor, nurse, or pharmacist is saying, informed consents. These are the forms you have to sign when you're going to have a test or a procedure done. Discharge instructions. These are the instructions you get when you're leaving the hospital after a stay or after you've had a test or a procedure. Health education materials, insurance applications, and information. Let's talk about getting help in your language. If you don't speak English well or at all, you have the right to interpretation help in your own language free of charge. Also, providers are required by law to provide interpretation services. Highmark Health Options has created a language access card in 29 languages. This card will help service providers identify your language before calling an interpreter for assistance. You can keep this card with your Medicaid and HHO cards. You use this card when you go to the doctor or pharmacy. You can also use it for the following services: emergency and non-emergency services, social services, public schools and universities, doctor visits, hospitals and pharmacies, in courts, public assistance programs, for public transportation, and for other public services. There are 4 ways to get the card so you can carry it with you. First, you can download and print the card. If you don't have a printer, ask for help at your local library. Second, you can take a screenshot or save the card on your phone to use it when you need it. Third, you can call Member Services to get a printed card in the mail. You can reach Member Services at 1-844-325-6251, Monday through Friday from 8 a.m. to 8 p.m. And fourth, you can attend a Member Advisory Council meeting, which is held 4 times per year. The meeting takes place in a different county and community location. Remember to keep the card with you at all times and use it to ask for help in your language. This card is not required to receive service. To get the card online, you can visit the highmarkhealthoptions.com website at hho.fyi/LAC. Or you can scan this QR code using your smartphone's camera app. Here is an example of the Haitian Creole Language Access Card. You'll notice at the bottom of each card is the section you would cut out to keep with your Medicaid and HHO cards. As we mentioned earlier, The language access cards are available in 29 languages. Let's talk about talking with your doctor. You may not have ever considered yourself a partner with your doctor, but these are simple ways to partner with your doctor as you talk about your health. Tell your doctor what's bothering you. Ask questions about how you feel so the doctor will be able to help you. Ask questions. Tell the doctor when there is something you don't understand. You can ask the doctor to talk slower. You can ask the doctor to talk louder. You can ask the doctor to show you a picture. A patient-doctor relationship is meant to be a healthy partnership. If you don't understand your doctor, never be too embarrassed to ask questions. When you think you understand, you can repeat information and instructions back to your doctor to make sure. It's always okay to say, "I don't understand." Talking about your health means sharing information about how you feel. Sometimes it can be hard to remember everything that is bothering you during your doctor visit. Making a list of your symptoms and anything that is bothering you before you visit will help so you do not forget to tell your doctor anything. Put your most important concerns at the top of your list. In addition to the list of your symptoms, there are a few other things to share with your doctor. Are there things that your body should be doing, but your body isn't doing them? Perhaps you missed a menstrual cycle. Maybe you're not pooping. Another example might be you're no longer having hot flashes, so the medication you're taking must be working. Sometimes doctors forget what they prescribed last time they saw you, and so they don't ask about it. Did you stop taking a medication because you may have had a reaction to it or it made you feel funny? Have you recently had a vaccination and you didn't feel well afterwards? Maybe you had chills or sweats or a low-grade fever. Sometimes this happens to people after a vaccination. All of these things are things that your doctor needs to know. Symptoms can be physical, such as pain, fever, a lump or bump, a change in your energy level, having trouble sleeping, or unexplained weight loss. Symptoms can also involve your thoughts and feelings. You'll want to tell your doctor if you're feeling confused or if you feel sad a lot. There are things your doctor will want to know. What are the symptoms? When did the symptoms start? How often does it happen? Is it all the time or only at certain times during the day? What makes it better? What makes it worse? Does this keep you from doing the things you would normally do? Has this ever happened to you before? If it has, when did it happen? It can help to write down the answers to some of these questions before your doctor visit. 3 important steps in doctor-patient communication are sharing information, receiving information, and making decisions together about your healthcare. Let's talk about questions to ask your doctor. Sometimes doctors do blood tests, x-rays, or other screenings to help find out what is wrong or to learn about your health problem. These are questions you might want to ask before you get a screening done. What will the screenings tell us? What does it involve? How should I get ready? Are there any dangers or side effects? After the doctor has given you the diagnosis, this is what the doctor thinks your problem is, you will have questions. These are examples of what some of those questions might be. What may have caused this condition? How long will it last? Is it permanent? How is this condition treated or managed? How will it affect me? Some questions to ask your doctor about treatment options are, what are my treatment choices? Which treatment is best for me, given my values, my beliefs, and my circumstances? And what are the risks and the benefits? Sometimes you will feel more empowered to have an open, honest conversation about your health when you have a support person with you. Consider taking along a family member or a friend when you visit the doctor. This person can act as your health advocate. If you feel unsure about a topic, the other person can help you describe your feelings or ask questions on your behalf. It also helps to have someone else's perspective. They may think of questions or raise concerns that you hadn't considered. Lastly, your health advocate can help you if there are language or cultural differences between you and your doctor. And that brings us to the end of this topic. If you would like to learn more about the Health Awareness Series and watch more episodes, visit hho.fyi/HAS. Thank you for joining us. We'll see you soon.